I'm delighted to be speaking today with Tim Newfield, who is an environmental historian and historical epidemiologist at Georgetown, as well as being an assistant professor in the departments of history and biology. He works in particular on the history of infectious disease and climate in the first millennium CE. So thank you for being here today, Tim.
Thank you for having me, Al and Stephanie. Very nice to be here.
You're welcome. So I thought maybe we could start in the ancient world and work our way towards the present. So I wanted to ask you first, were there any occasions in the ancient world in which there were, if not maybe pandemics, outbreaks of infectious disease that affected East and West Asia as well as Europe?
Greco-Roman antiquity, at least, was marked by a number of large outbreaks of disease. The few of these that have caught the attention of historians, or a few of these have caught the attention of historians for centuries now, namely the Athenian plague of roughly 430 BCE, the Antonine plague of perhaps 165 to 190 CE, and the Cyprianic plague in the mid-3rd century. Other ancient outbreaks of disease also occurred in the Mediterranean region, that is, but they've attracted less scholarly attention so far. Some of them may have, quite frankly, for all we know, have killed more than these well-known and famous 3 plagues. But many ancient plagues, like the 3 plagues that I just mentioned, the Athenian plague, the Antonine plague, and the Cyprianic plague, are thought to have had distant non-Greco-Roman origins, both by contemporaries on the ground, or at least in some of the sources that survive, and also by modern historians for a number of years now. So Thucydides blamed the Athenian plague on East Africa. Contemporaries to the Antonine plague associated it with Southwest Asia, though it has also been linked with North Africa. And the Cyprianic plague has been as well tied to East Africa, though some scholars now favor the Pontic steppe north of the Black Sea. But I think it's key to stress the limits of our knowledge and some humility here, that we really don't know the absolute origins of these things. In fact, these regions that I just identified could be the places where these plagues first entered the purview of literate observers. So in the 19th to 20th century, scholars wagered that the Antonine plague and Cyprianic plague had East Asian origins. And scholars, historical epidemiologists early on did this, and they perpetuated these ideas, in particular that the Antonine and Cyprianic plague had East Asian origins. I don't myself work with the East Asian source material, but some scholars who do have consciously, or perhaps not consciously, adopted what can be regarded as an epidemiologically orientalist perspective. And they have assumed, like ancient authors, that the diseases that the Romans and the Greeks spoke of had to have come from someplace far afield. That the ancient plagues had to have come from far removed from the Mediterranean world. Whether that was the case or not, we don't always know. East Asian source material, again, that I don't work personally, does mention, normally very briefly and vaguely, epidemics, for instance, in the 150s and the 160s leading up to the Antonine plague, and in the 230s and the 240s leading up to the Cyprianic plague. But we have no grounds, whether based on the description of the clinical expression of the disease or on any sort of paleogenomics or paleogenetic grounds, to connect these outbreaks. They are, I would say, probably not connected, but they have been connected in the past. If I can take just a little bit more of your time and say, if we move forward to the Justinianic plague, we know a little bit more. The Justinianic plague occurs in late antiquity. It shows up in the Mediterranean region in 541 CE, and then persists in the Mediterranean region for upwards of 210 years, as far as we know. And the common narrative was for a very long time that it was imported repeatedly from somewhere farther afield in Asia or in East Africa, and that the Mediterranean region was repeatedly devastated by this imported disease. Sources have pointed to either East Africa, using again Thucydides' influence. His account of the Athenian plague had a great deal of influence throughout antiquity and into the Middle Ages. Or also, it was said to have come from Southwestern Asia. But scholars, again, in the 19th and 20th centuries push the idea that it could have come from farther afield even yet. But thanks to the discovery of remnants of Yersinia pestis, the pathogen that causes plague in a number of tens of people from the late antique world, and the reconstruction, the drafting of a genome of Yersinia pestis, of a late antique genome of Yersinia pestis, if you will. We know where that fits into plague's family tree. And we know, we've learned a number of really cool things, actually. I'll be quiet in a second. I know you probably don't want long responses. But we know, for instance, that the plague was that the disease was introduced once, and that it established one or maybe more reservoirs in the region from which it spilled over. So contrary to the epidemiological Orientalist perspective, it didn't continuously come in from farther afield from the East or from East Africa, for instance. And we also know that its ultimate origin would have been somewhere in Central Asia, but its proximate origin might have been much closer to the Mediterranean region. So some scholars have still claimed that East Africa was, or the Horn of Africa, or even southwestern Arabia was a place where the Justinianic plague first got going, but we really don't know yet. But we are getting closer, at least, in the history of that ancient outbreak than we are for the Athenian, Antonine, or Cyprianic plague. Sorry, I'll try to keep my answers short.
No, that's great, Tim. Thank you. That's a really great overview of what's known from antiquity. Oh, sorry, I think you've frozen there. Okay, sorry, we're back now.
The time out there, it could have been my kid on a.
Can I ask, what do we know about the severity of the various outbreaks that you've described? Do we have any even approximate statistics of numbers of people infected or killed, or the duration of these outbreaks?
There's nothing approaching morbidity or mortality statistics of the like that we're used to these days, or that we would want, really, when we reflect back. The severity is really hard to gauge, and it's more often than not a subject of considerable debate. So the Antonine plague has gone through 3 cycles of what could be called maximalist and minimalist perspectives. The Justinianic plague is now quite a hot topic. For a long time, scholars had argued that it more or less facilitated or sped up the decline of the ancient world. But now a group of scholars, and I'm involved with that group, have pushed back on that narrative a little bit, not saying that the Justinianic plague wasn't a big deal, but just saying that our means of, or the ways by which we have stated it was a big deal, require reassessing. So severity is really hard to get at, and it's really been a subject of debate. That is the subject really of an entire course. In terms of the frequency, looking through my own files, between roughly 500 CE going back to 200 BCE, there are more than 50 recorded epidemics in ancient sources. So 50 plus epidemics, but it would be a stretch for us to say that an epidemic occurred every 10 to 14 years on the basis of the record that we have, because the record is incomplete. Certainly some of those epidemics were interregional. Certainly some of them would have killed a large number of people. Historians have come up with a whole range of stats. Some say that 50% of the Mediterranean population died in the Justinianic plague. For the Antonine plague, some say 7%. Some have said has gone as low as 2%. Some have gone as high as 20%. But we really don't have a means for establishing firm or reliable mortality counts or estimates even. So the guesstimates need to be treated gingerly. If one is going to put 75 million people around the Mediterranean basin at the time of the Antonine plague and 20% die, we're talking about a really significant mortality, somewhere around the range of 15 million or so, right? But even 2% is a huge mortality, 2%, if we're going to put that same number around the Mediterranean, we're looking at something around a little bit shy than 2 million people, maybe 1.5 million lives. That's a lot. That is a lot, of course. But yeah, so the jury is still kind of out, and I think it's going to remain out for a while.
Right. So I'm sure that's right, given the nature of the source material. So you mentioned earlier that some people, some scholars have attributed very large effects to these epidemics. So the decline of the Roman Empire, let's say, or the decline at the time of Justinian. What do we know about kind of the general effects of these epidemics on ancient societies? I mean, what were the sort of economic, societal, political impacts of these various epidemics?
Scholars have argued for cultural, economic, and social effects of all sorts, whether from the adoption of or the flourishing of a new cult, for instance, like the Marian cult in the wake of the Justinian Empire, or the decline in brick production and marble production, the shrinkage of the military in the context of the Antonine and Cyprianic plagues. A number of arguments have been made. One of the things that I think scholars continue to struggle with, though, is that the evidence is such that even establishing correlation spatiotemporally can be difficult. So if we're having difficulty establishing correlation, establishing causation, the next step is even harder. So a lot of arguments have been made. There's been pushback against some of those arguments, but it's not easy. It's not by any means a simple affair to jump back into the ancient world and find any sort of solid lessons or warnings for the present day. I'm not saying that it's not possible. I'm not saying that there are not what some scholars have referred to, what some medical historians or historical epidemiologists have referred to as universal truths. I think there are some quote unquote universal truths and outbreaks of disease, some which we experience today and some which we can trace back to antiquity. But establishing the particular social or economic fallout of any particular plague is difficult. So if let's take the Cyprianic plague and the ways that the Cyprianic plague can be interpreted. The Cyprianic plague is typically dated to 250 to 270 CE. We don't really have good start or end dates. We don't really have an idea of where it originates. We don't have a firm diagnosis by any means. All of these things complicate our ability to establish its geographical spread, its epidemiology, to speculate on its morbidity and mortality trends. But it occurs, it overlaps in time and to some degree in space with what's referred to as the third century crisis. The third century crisis is very much marked by political instability, some barbarian migrations, the splintering of the empire at times. It's a military crisis that does impact aspects of the Roman world, but even itself, it's a crisis that some specialists in the third century have argued wasn't really a crisis at all. But some historians of the Cyprianic plague have fit the plague into the history of the crisis and attributed the crisis in part to the plague, saying that the plague aggravated the crisis, sped it up. So the crisis, for instance, is normally dated to somewhere between 235 and 284, 285 CE, but in some Cyprianic plague scholarship, the crisis has been condensed to 250 to 270 to overline with the exact dates of the Cyprianic plague, which all, of course, influences the severity and the significance that we attribute to that plague. But without knowing the identity, without having a good idea of its chronology or geography, it's pretty difficult. It's pretty difficult. It's also fascinating and interesting. And the fact that we are relying increasingly on the natural sciences to inform our understanding of outbreaks of disease in the past makes the field so exciting and vibrant. It's really a wonderful area to be in right now. There is a lot of debate. There's always going to be a lot of debate, particularly between scholars who privilege the natural sciences and what we can learn from them, and scholars that privilege the written record or the archaeological record. But still, from so many fields of study, we are learning a lot, and we are inching forward, I think. But establishing correlation is difficult, and therefore establishing causation is even more difficult.
Right. Thank you. So we have a question from a participant that kind of picks up on something you just said. And it's that they were curious that which came first for you as a scholar, an interest in history or an interest in epidemics and biology?
Good question. Well, as a high school student that wasn't always doing what I should have been doing, my mother kept all of her nursing textbooks very close to my Nintendo system. And I was often leafing through those textbooks and increasingly fascinated with and asking her questions. I've always been interested in health and in particular disease, which is why I really don't call myself a medical historian. I'm more of an environmental historian of disease, or an interdisciplinary historian of disease. I also grew up in an agricultural community. I had many friends in high school that had farms, and I was always interested in food production as well. So initially, when I was interested in disease, it was, of course, through my mother's textbooks in human disease, but I did develop a real fascination with livestock disease. And once I entered university, initially to become a high school history teacher, and that didn't pan out, I realized that you could do history professionally. And I also realized that people have been neglecting the health and welfare of livestock for centuries. So I wanted to study the history of livestock disease. I did do that for a number of years. I still do that, but I've broadened out considerably, particularly since arriving at Georgetown in 2017. So the two interests kind of overlap in time, and kind of have had each other.
Mm-hmm. Thank you. So to go back to the ancient world for a minute, did ancient societies have any way of coping with pandemics? Did they quarantine? Did they have any of the kind of methods that we've seen in action recently?
I say again, it would depend on who you read. Certainly there was I think it was a Smithsonian article from February or so about all the lessons we could learn from the Antonine Plague for the present day. Some scholars might struggle with the claims made in that article. But I guess we could say that there's some effort to self-isolate or to keep a distance, to flee outbreaks of disease in the ancient world, whether staying at home or the elite and more privileged who could flee to another city and had the means to flee and someone to flee to. So keeping distance, I think, was something that we could certainly say was practiced in the ancient past during the three key outbreaks that I've mentioned, and then the Justinian as well, that the source material isn't as rich as we would like in that particular regard. But most of the things we think of, quarantines, sanitary borders, and those sorts of things, come much later. They're more late medieval or early modern than they are ancient or late antique.
I mean, can you talk a little bit about that when public health measures that we might recognize as such come into being in late medieval period?
Sure. I feel like I should have reviewed notes, but I can definitely provide some insight on that. I do teach that, but it's been one heck of a summer being a full-time academic and a full-time parent with no camps or anything like that, and everyone crammed into a small space. But yes, so this is outside of my area of expertise, but it's often said in the media, it has often been said in the media during SARS-2 or SARS-CoV-2 or COVID-19, that the Black Death spawned quarantines and the Black Death spawned sanitary borders. That's not really necessarily the case. In the wake of the Black Death, during the second pandemic, slowly quarantines and plague hospitals develop in Southern Europe, in the Central Mediterranean region, and then in the Western, and then in the East. Plague hospitals, places where people who had been identified as suffering plague, where they could be quarantined and set up, were established in Venice in the 1420s, in Madrid in the 1430s, if I'm remembering correctly, Milan in the 1440s. So these things come long after my period, after the Black Death, which is the initial onslaught of the second plague pandemic. So the second plague pandemic begins with the Black Death, but then persists for centuries and centuries. And some now, thanks to paleogenomics and to critical scholarship being conducted by historians, has really kind of blurred the line between the second and third pandemic, the work of Newkett Varlick in particular. But yeah, so often in what we think of as these Black Death inspired public health responses like quarantines and sanitary borders and the closing of frontiers, those develop in the wake of the Black Death. But there are some cases where it's pretty quick with the Black Death. Dubrovnik is quarantining things associated with plague and people associated with plague in the year 1377. Milan even closes its doors, supposedly to great effect in 1348 itself. In subsequent outbreaks of plague in the second pandemic, it tells people to shoo away or shoos them away. So yeah, in the wake of the Black Death, but also it's important to say, and I know this because I've taught this work only in the spring when we first went online, that scholarship has also recently pushed back on the narrative that everything was new after the Black Death. Often the legislation, the ordinances that were issued in the wake of the Black Death, sometimes in the immediate context of the Black Death, sanitary or hygienic sort of ordinances that put controls on we could say, the health landscape of a late medieval city have roots that predate the Black Death. So already in the high Middle Ages, in the 13th century and in the early 14th century, if not before, it could be before, there's trends going towards the sort of things that we see develop after the Black Death. I said I would give you shorter responses, and I'm so far failing to do that.
That was great, thank you. So you mentioned earlier that while each event, of course, is unique, in some ways there are some universal truths about epidemics and pandemics. And I'm wondering if you could tell us a little bit more about what those are, and just kind of, I guess, help us understand whether what we're going through is something that's never been seen before, or whether it has much in common with other events you described.
Well, there's certainly been an effort, and early on, I think, I don't mean to pick on the New York Times, it's just one of the newspapers I read most regularly. Early on in late January even, when SARS-2 had yet to really globalize or claim a large number of lives as far as we are aware, connections were already made with the 1918 influenza, which is really the 1917-1920 influenza, 3 individual waves of influenza that overlapped often in some world regions. And we were said to take lessons from that experience. Often these connections, these analogies were drawn very flippantly, very quickly, without a lot of care, and the readers were left with a poor understanding of how the two pandemics actually relate and how alike they are. I think that most people will understand the Spanish flu, which we shouldn't call the Spanish flu, but the Spanish flu as being a very big event in global history in terms of disease history. And they'll probably also be fully aware of the Black Death, or the bubonic plague, it's often referred to, but plague, Yersinia pestis, causes can clinically manifest in a number of ways, not just bubonically. So we shouldn't really say the bubonic plague either, but tangent, sorry. Yeah, so early on, we're seeing a lot of connections drawn between our current predicament, the current pandemic, and the 1918 influenza and the Black Death, but we're not, those linkages aren't really being fleshed out in any meaningful way. We're not really getting a sense of the severity of them. The 1918 influenza linkage still doesn't make any sense to me. The 1957 influenza, the 1968 influenza, even the 1889 influenza really are more in line with what we're going through. We're approaching 900,000 deaths from SARS-2. The confirmed deaths, the real number might be twice that, because of course the statistics that we would like to have are not available for all regions or being kept in the same way. So maybe it's 2 times that, maybe 3 times that, but even if we're at 3 million deaths, we're nowhere near the mortality of the 1918 influenza. So the 1918 influenza, the safe estimate is 25 million people. As soon as you see scholars say 50 million or 100 million, sometimes they say 50 to 100 million, that is a red flag that there are some major unknowns with that pandemic. The total aggregate mortality, we don't know, but over 25 million. And if we are to inflate for today's numbers, we're looking at somewhere around 210 million. But while influenza is sure guaranteed to spill over, pandemic influenza is going to happen again, we are not going to have the 1918 influenza again. The demographic profile, the epidemiological profile of 1918 no longer exists. Every pandemic is a product of its own time. Every pandemic is unique. Epidemiologists say you've seen one pandemic, you've seen one pandemic. No 2 diseases are the same. So sure, pandemic influenza is spread via the respiratory tract. Sure, it can spread silently. Sure, it can claim lots of lives among the elderly and among the young. But COVID-19's disease profile is very different. It's a respiratory pathogen. It can spread asymptomatically. It doesn't claim a lot of lives in the middle segments of a population, so people in their 20s, 30s, and 40s, which is exactly what the 1918 or 1917, 1920 influenza did, which had a W mortality pattern and not a U mortality pattern. There's so many things that we don't know about the 1918 influenza, which also just makes the idea that we can draw these simple linkages an issue. We don't know where it originated. Since 1927, we have been arguing whether it originated first in northern France, first in continental US, or first in China. It could have been someplace else, quite frankly. But those are the three places that we've been pushing. We don't know true morbidity rates. It's often said 1/3 of the planet fell sick. We don't actually know that confidently. And it's often said that the mortality was at least 25 million. That I think is safe. More than that, 50 to 100, more work needs to be done. But despite all of these unknowns, to come back to your question, I think there still are some universal truths that we can discern from outbreaks of disease, from what we're going through now, through what we saw during the West African Ebola outbreak of 2013, 2015, what we saw in Zika, what we saw in 2009 influenza. And that one of the first truths is denial. The outbreak is said not to be what it's said to be by some, and an attempt to contain the information or to control the information by whatever political authorities are in a position to do that. Then after denial, we have scapegoating. Scapegoating has deep roots in Western history going back to antiquity. I've already mentioned Thucydides' pegging of the plague of Athens on East Africa. And of course, with no concept of pathogen, with no contact tracing, how exactly was Thucydides to make that claim? East Africa was understood.
Sorry, Tim, I think you've frozen for a second.
The attempt to protect one's own interests, whether that be a town, a region, a province, or a country. And then after that, the universal truth that the most marginalized, whether along class or racial lines, are going to be the ones that suffer the brunt of the disease and the ones that suffer the disease for the longest. If the disease is going to become endemic, it's going to become endemic in those most marginalized populations. Those are among what I think are truths that we just know are going to happen. They're going to happen again next time unless we do something about it, about social inequities. Yes, sorry.
Yeah. Thank you. No, thank you. So I guess what you're saying in a sense is that it's not the scientific aspects that stay the same time to time. It's some of the sort of very human and cultural reactions to the pandemics that we can see patterns.
Things that we learned about that we haven't.
Yeah. So we've just got about 2 more minutes. So I wonder if we could just conclude by, if you had advice to give to fellow historians when trying to speak to the public about COVID-19, you know, in op-eds and opinion pieces, what kind of advice would you give?
I think we need more op-eds. It would have been nice had more historians been able, and of course we were in the middle of a semester and transitioning to online, so it wasn't easy. But it would have been great to have more op-eds out there to confront these simple narratives, the misuse and abuse of the past that we were finding on a daily basis in major media outlets across the planet, from Chile to Scandinavia, from the US all the way over to India. We should have had more op-eds to complicate those simple narratives, to illustrate the mistakes that can be made, the importance of context, and how there might be things that might repeat themselves, but every epidemic is different, every pandemic is different, every disease is different. I guess what I'm saying is it would have been nice if historians were able to set the paradigms or influence the conversation before journalists had already pushed the 1918 connections, which again was already happening in late January, or push the Black Death narratives that we were seeing in the media as well. All of that needed to be broken down. It would have been great I guess what I'm saying also would have been great. Now there's a need for historians to organize, to establish some sort of consortium that they are prepared and ready to go for the next time. I couldn't help but notice that my colleagues in ecology and epidemiology at Georgetown and farther afield were prepared to pivot as soon as the pandemic happened. Historians are slow-moving creatures. We don't work like that. But those of us who work on the history of disease need to be prepared to act. So that's something that we need to think of going forward.
Thank you, Tim. Unfortunately, we're going to have to leave it there because we've run out of time. This is obviously a conversation we could continue for quite some time, but I want to thank you again for being here today.
Thank you for having me. Sorry again for my long-windedness.
It was a fascinating talk. And I just wanted to say to everyone that next week we'll be talking to Derek Reveron of the Naval War College about the US as an incidental superpower. So I hope you'll be able to join us for that. And in the meantime, hope everyone stays safe and well. Thank you for being here today. Take care. Bye-bye.